Last night, we broke the news that Texas kicked hundreds of seniors off of Medicare benefits by mistake. 350 Texans on Social Security had some of their benefits stripped over the last year through no fault of their own, and some are still waiting for the state to make it right. Our very own Ryan Chandler joining us now uncovered this news. You're going to walk us through this. Who does this mistake impact?
So this all involves something called the Medicare Savings Program. Essentially, if you're on Social Security and Medicare, you can enroll in Medicare Part B, kind of the deluxe plan for Medicare. And usually the state would take the payment for that Part B out of your Social Security check, which is already small, but the state offers a program to pay the federal government for that coverage so that you can take home the entirety of your check from Social Security every month. In about 350 cases, though, we found the state improperly removed seniors from that payment, costing many of them as much as $200 a month. And remember, for these seniors who are living off of Social Security, many of them can't work. I spoke with one senior who lives off of less than $1,000 a month. If he doesn't get this payment, he's now living off of less than $800. So we're talking about people in desperate need, many of whom can't find other ways of income. So while it may just be about $200, that is a significant hit for these people. Okay,
and Ryan, this really isn't the first time that we found serious issues like this, right?
We've been reporting on issues inside Health and Human Services for a year now. Last summer, this all started when federal COVID protections ended and put a huge burden on the state system. And essentially, the Biden administration provided what is known as the continuous coverage provision during the pandemic, which said states don't disenroll any of your Medicaid enrollees during the pandemic, because during a pandemic, healthcare is pretty important. Well, after they declared the end of the pandemic, Texas then had to go back and reassess who was still eligible for Medicaid, and that gave them a caseload of about 6 million people that they had to get to reapply and reassess to see if they can stay on that program, and it simply was unmanageable. I mean, we had 100,000 people who were kicked off by mistake from Medicaid. These are some of the poorest Texans. Many of them, thousands of children lost their health insurance due to state error. And people who also needed nutritional assistance from SNAP were waiting months just to get their applications reviewed. If you've ever needed food or health care, you know that those are urgent needs. You need them now. You can't wait for months. In fact, the federal government puts strict limits on how long an application can be sitting in a state system before it gets reviewed. For SNAP, it's 30 days. For Medicaid, it's 45 days. People were waiting 200 days. For an urgent need that they needed the state to deal with effectively. So this all goes into issues of understaffing and overwork that HHS is dealing with right now.
Okay, so you talk about these caseloads that are not manageable. This is a problem that you've covered extensively. What's the solution? What are you hearing? What can the state do to fix this?
We haven't heard any word from Governor Abbott relating to this most recent reporting. He's been aware of the long-standing issues with HHS. But really, in my assessment, this is a legislative issue, right? There's only so much that a state agency can do with the staffing that they have. And if they need more staff, maybe more compensation and a better work environment, that's ultimately going to have to come from state money, and the legislature is going to have to review how HHS is dealing with the problems they have and what the state can give them in order to make it better. We've heard from whistleblowers that say they're just overworked, underpaid, and are dealing with an environment inside the agency that's just not workable. So most of those solutions will have to come from a statewide perspective.
All right, Ryan Chandler, thanks so much. You can view his full story on KXAN.com.